Chapter 9. By the end of this chapter, students will be able to
understand and compare prevention approaches to substance use and analyze how external factors influence behavior. What is the war on drugs? This quick video, narrated by Jay-Z, talking about the war on drugs is a great tool to introduce the topic to students. Encourage students, either in pairings or in a large group, to share their thoughts and opinions of the video that they just watched. A couple of questions to get the conversation started could be, have you heard of the war on drugs before today? What is one thing that you learned after watching the video that you didn't know before? In June of 1971, President Nixon declared a war on drugs. He declared drug abuse to be public enemy number one. The war on drugs aimed to eradicate illicit drug use in the United States through expansive government regulation, increasing penalties, enforcement, and incarceration sentences for drug offenders. This resulted in the rates of incarcerations for nonviolent drug offenses alone increasing from 50,000 in 1980 to 400,000 in 1997. Richard Nixon's domestic policy advisor, John Ehrlichman, revealed that the war on drugs had began as a racially motivated crusade to criminalize Black people and admitted that top-level government officials knew that they were spreading misinformation in efforts to villainize substances. As harsher federal drug legislation began to be enacted, sentencing disparities that punish crack cocaine offenses more harshly than powder cocaine offenses unjustly and disproportionately penalize individuals of color compared to white individuals. Whites are disproportionately less likely to be prosecuted for drug offenses in the first place. When prosecuted, they are more likely to be acquitted, and if convicted, are much less likely to be sent to prison. This unequal enforcement ignores the universal nature of drug dependency, as well as the universal appeal of drugs themselves. The war on drugs did not start with President Nixon either, and dates back to the 19th century. This demonstrates how the United States has a far-reaching history of penalizing certain substances harsher than others as a means of achieving a political agenda. At the height of the war on drugs, cocaine, more specifically crack cocaine, was targeted by policymakers and law enforcement as a major threat to the American people. In 1986, President Ronald Reagan enacted the Anti-Drug Abuse Act. This law created a difference in the way crack cocaine and powdered cocaine would be dealt with during arrest and in the courts. Crack at the time was promoted to marginalized communities of color, while powdered cocaine was a fad amongst affluent white communities. In 2010, President Barack Obama signed into law the Fair Sentencing Act, which reduced sentencing disparities between crack and powdered cocaine. Although the evidence at the time was clear, crack cocaine and powdered cocaine were no different from one another. This was a step in the right direction following decades of unjust criminalization. In 2018, the First Step Act made the ratio reduction retroactive, meaning thousands of Americans serving unjust sentences would receive reduced sentences or be released in accordance with the updated drug policies. Advocates and lawmakers continue to call for the complete elimination of the racist disparities in our legal systems.
The opioid crisis continued to reveal racial biases as the war on drugs continued to the next phase. With the turn of the century, the landscape of what drugs were being used and who was falling victim to the war on drugs began to shift. The opioid epidemic in the United States has largely centered on white Americans, pushing minorities to the sidelines, even as the number of opioid-related deaths amongst people of color is currently on the rise. Some experts believe that the number would be even higher if minorities had the same access to healthcare as whites, highlighting the complex underlying racial disparities in the United States healthcare system. Historically, communities of color experience a multitude of barriers when trying to access medical care, unlike their white counterparts. These disparities in access are heavily influenced by socioeconomic status, residential location, racial biases, and stereotypes. A clear example of this is the promotion of illegitimate racial biases in medical literature, claiming that patients of color have higher pain tolerances than their white counterparts, which resulted in overprescribing painkillers to whites and underprescribing those same medication to people of color. From 1999 up until 2010, there was an increase in opioid prescriptions that led to an uptick in prescription overdoses. A major contributing factor was people taking oral opioids in unintended ways, such as smoking, snorting, and injecting the drug. This made the drugs enter the bloodstream faster and act more quickly, thereby heightening the risk of overdose. From 2010 to 2013, there was an increase in deaths amongst people using heroin. Even though heroin was illegal, it was often easier and cheaper to buy than illegally obtained prescription drugs. In 2016, synthetic opioids surpassed prescription opioids as the leading cause of overdose deaths. Increased availability of illicitly manufactured fentanyl and heroin laced with fentanyl is now considered one of the greatest emerging threats to the public health in the United States. We can trace the origins of today's opioid epidemic back to 1996, when Purdue Pharma first developed and marketed OxyContin, with the misleading claim that the drug was less prone to misuse. It was not until years later that research debunked this claim and found that the risk for misuse was greater with their extended-release formula pills. Purdue Pharma heavily promoted OxyContin to general practitioners who often had little training in serious pain treatment or in recognizing signs of substance misuse in their patients. In order for us to understand the impacts of substance use today, we need to look back to the policies and perspectives that led us here. As countless Americans became addicted to oxycodone and other prescription opioids, U.S. drug manufacturers, distributors, and chain pharmacies made billions in profit. President George W. Bush's administration continued the precedent of holding a hard line when it came to fighting the war on drugs. However, there was pressure for the federal government to intervene and regulate the predatory practices of Big Pharma. As the government began to crack down on manufacturers, there was a tremendous vacuum in the painkiller market. Millions of people already dependent on opioids, now driven to seek out a substitute substance. Heroin, for example, was a cheaper and more readily available alternative for those who developed a significant relationship with prescription painkillers. The Obama administration defunded and dismantled key drug monitoring programs in the years leading up to the fentanyl crisis, but increased public health funding. The Obama administration steered clear of using the terminology "the war on drugs." This is due to the societal and historical connotations associated with the phrase that harken back to policies of criminalization and incarceration. Obama signed a bill in 2016 that would spend $1 billion over 2 years to combat the growing opioid epidemic, painkiller, and heroin epidemic, all through public health, not criminal justice programs. President Donald Trump took office just as the fentanyl epidemic was about to explode. Trump made it a cornerstone promise throughout his 2016 presidential campaign to build a wall along the U.S. southern border in an effort to stop drug traffickers from bringing illicit substances into the country. At the time, and still true to this day, most drug traffickers are passing through official ports of entry in California and Arizona. Over 90% of fentanyl seizures occur at legal crossing points or interior vehicle checkpoints, not on illegal migration routes. Once President Joe Biden took office, his administration has amplified a public messaging campaign to warn about fentanyl's deadly threat. Biden stepped up efforts to improve scanning technology at border crossings as well. In 2021, 86% of convicted fentanyl drug traffickers were U.S. citizens, 10 times greater than convictions of undocumented immigrants for the same offense. In 2023, President Joe Biden's drug czar declared that fentanyl mixed with xylazine represents an emerging threat facing the nation. This is the first time a presidential administration has formally labeled an illicit drug an emerging threat, and then required the federal government to take further action. So, is there still a war on drugs? Is the war on drugs that was termed decades ago still present? No. However, as a country, we still face present emerging drug threats that are a direct consequence of these outdated policies. These threats must be addressed in order to promote the health and welfare of all individuals. Please have students respond in one paragraph to this exit ticket. From your perspective, how do you think the war on drugs impacts substance use and the opioid epidemic today?